back again. Today we're talking about the mind and body connection and how they work together to heal. Sometimes science is able to explain how this healing takes place, like with meditation, and sometimes it can. What we're talking about next isn't easily measured, but regardless, it's something that helps many people. Our next guest is an energy medicine specialist. Now, energy medicine is a therapeutic approach to healing. The therapy uses touch to influence the energy system, thus affecting the physical, emotional, mental, and spiritual health and healing. The goal of energy medicine is to restore harmony and balance in the energy system to help the person to heal himself. Please welcome Elaine Grohman. Elaine is an energy medicine specialist and uses touch therapy, right?
Yes,
to help.
that's true.
Tell us about that and the healing properties of the touch therapy.
Well, as Dr. Hansen had spoken earlier, we need to be touched. You know, we are tactile beings. And we have understood from our own experiences, I know that, you know, children that are not touched, they have failure to thrive. Failure to thrive is not exclusive to infants.
Correct.
It goes throughout our whole life, and when we forget that we need this interaction with one another, it's very important. And so when I'm working with people, I gently touch them. It's not manipulative like massage. It's very gentle touch. And I help them by speaking to them as I'm working, helping them to learn how to recognize what it is they're feeling. Most people don't know how to pay attention to their body.
Yeah, because you have to be attuned to that, don't you?
Well, we have to learn how to pay attention. It's not that we have to be attuned. We're so taught to be distracted by the subtleties of the human body. And as you know, as a gastroenterologist, the body is incredibly subtle.
Oh, yes.
And we're so used to big bangs. Well, we don't know how to be quiet. So I ask people when I'm working with them, what do you notice about yourself? What are you feeling? So I try very hard not to lead them by saying, do you feel this or do you feel that? I say, what do you feel?
And what do you usually hear the first time you do it?
Generally speaking, people will say that they feel, first of all, a sense of peace. And if they're feeling that, I know something's happening. And if they feel a tingling sensation, because our body, every bit of information that our body receives comes through our neurological impulses. So if that's happening, then we know our body knows how to make a peptide, it knows how to grow our hair, it knows how to do so many things. But we need that energy to move through our system without hesitation, without things that are getting in the way, without our mind or our belief system
blocking it,
changing the course.
Yeah, it's very important. And let me ask you, if to be devil's advocate, so people who say, well, that's all great, but what if that feeling of peace or the feeling that you're talking about is a placebo effect?
If I could give you an idea of something that I actually did myself one time,
yes,
and it was a placebo effect. I was given a prescription that was going to cost me $500. $500. And I handed it back to the pharmacist and I said, no, thank you, I'm going to find my own placebo. And you know what I did? I went to the candy counter. I said, okay, which one of you guys is going to work for me?
Yeah, exactly.
And I thought, you know what, I'm going to bring something joyful into my life. And as you know, as a doctor, it's going to bring in cortisol and different kinds of things.
Sure.
The way you think affects your physiology. So I recognize the placebo effect. They have no idea how in medicine or in research how the placebo effect works.
Now, I know we went to your office and tried to help this young lady.
Yes.
And then let's see how it went. Let's take a look.
Please.
I injured my shoulder my sophomore year of high school in a car accident. I was in the passenger side and it jerked me forward and partially dislocated it. And I went to the doctor. They said it'd be fine after a few weeks. I wore a sling and it did get better. But actually last year I was walking outside and I slipped on the ice and fell forward and jammed my shoulder back. And ever since then it hasn't been the same. I'm skeptical about energy work because there is no scientific validity to it. I tend to be a very concrete and logical person.
Hi, Natalia, I'm Elaine. Welcome.
Hi, pleasure to meet you. Thank you for seeing me.
Absolutely. Please come on in. Energy medicine is a form of integrative medicine. It has been known for centuries. And what it is a very gentle way of moving energy in the body. I want you to just close your eyes and relax, okay? And all that you need to do right now is just to imagine, if you would, that the tips of your fingers and the tips of your toes are open.
as if they're like straws, so that energy can just flow out of you. So I'm just going to just really quickly just touch the top of your head. As energy starts to move through the system, it kind of wakes up the nerve endings, so your body's responding to that.
My hands and feet are very tingly.
Very tingly. Good.
It feels like my hands are like, I don't want to say floating, but almost up.
I try not to have any particular expectation, but my hope is to bring some relief.
It feels very relaxed and almost light. Kind of like my feet, they're like floating.
You know, what can we do to support the human body to do what it knows how to do naturally, which is to heal? Tell me what you feel.
It's amazing.
I think that it's a beautiful way to kind of work together rather than have an either-or situation. It really needs to be blended, you know, because thank goodness we have pharmaceuticals, because we need those sometimes. Thank goodness we have surgical interventions, because we need those sometimes. But, you know, once those are done and the patient's on their own, what is their body able to do in order to heal?
We'll take a break. When we come back, we'll meet Natalia and find out how she's doing since her session. Please stay with us. Welcome back. Today we're talking about how the mind and the body can work together to heal itself. With us now in the studio is Stephanie Templeton. Please welcome her. Stephanie, thank you. So Stephanie has been suffering from chronic lower back pain, something a lot of people have and can relate to. Prior to the show today, Elaine had a session with Stephanie, and so tell us first of all about your pain a little bit. What's been going on?
I've had chronic back pain for the past 5 years. It was intermittent, but for the past 9 months, it's been consistent. The pain radiates down my leg. I have severe sciatica and also numbness down my left leg.
Oh, so did you have an injury or what happened?
About 5 years ago, they thought that it was due to after the birth of my son, and then my back would go out on me once in a while and cause severe spasms. But in October of 2013, I woke with severe back pain. I did some stretches, and then I went on my way taking my 2 kids to swim class. But while there, it tensed up on me and I could hardly bend over. So then I went to see a chiropractor who I normally didn't see because it was a weekend. And after the adjustment, leaving there, I could barely walk. And when I woke the next morning, I could not move on my own.
So did they tell you what happened?
They weren't exactly sure what happened. I had severe muscle spasms in my lower back, my hips and thighs, and that's when the sciatica and the numbness started.
Okay. And so tell me about your session. What did you feel? How did it go?
It was amazing. Elaine really put me at ease, and I wasn't sure what to expect because I had not had anything like that before.
Sure.
Yeah, and she started just placing her hands over me, and I felt a warmth and energy and like a pulsating, and there's a blanket over me, so it's not like...
Oh wow, so over the blanket.
Yeah, it was over the blanket. It's not like I could just feel her hands directly on my skin. And she placed them on various parts of my body, and I could tell there was a tingling sensation that intensified in the areas that I've had difficulties and trouble. And I felt this warmth and sensation of just energy throughout my body. It was really amazing.
How's your back feel?
It feels amazing right now. It feels really good.
Oh, that's great.
I was
nice
telling
job,
her,
Elaine. She loves it. So we also have in our audience Natalia. Please give her a nice round of applause as well. She went to Elaine's office, and Natalia, how did it go, and how did you feel immediately after the session?
I had a great experience at Elaine's office, and I think what I took away from it most, even more than the physical aspects, similar to Stephanie, I felt almost immediate relief of the pressure and pain in my shoulder. But aside from that, emotionally and almost spiritually, I was so much calmer and so much more relaxed and almost more comfortable, just in tune with my body and my surroundings. And I think that emotional relief was something I wasn't expecting to get. You know, I was incredibly skeptical at first, but something she said to me in there really stuck with me, which was, you know, we carry our stress, you know, in our chests and our bodies, and that pain in my shoulder kind of radiates when I am more stressed out. And that calming, soothing effect that I got from her office and from that visit and from that touch therapy was amazing, because I felt so much more relaxed. And as that stress kind of left my body, it almost felt like it was leaving through my fingertips and the tips of my toes. I could feel the pain going away and just becoming so much more less. And for the next few days after that, I felt